Hi, welcome to Everything Neuropathy with Dr. Karen May. I am Dr. Karen May, and today on Everything Neuropathy, we're going to talk about chemo-induced peripheral neuropathy. It's something that ravages so many people every single year to be told there's nothing that can be done. And so I'm going to give you good information today. Please understand, especially when you're on a journey with your treating cancer, you have got to talk to your doctors to understand where you're at, where your journey is at. Because this is great information, but you have to make certain it applies to you in your medical situation. So today is more informative and trying to help you understand what chemo-induced neuropathy is, how it's affected, how you can talk to your doctors, what questions to ask. But just know that in our clinic, there's over 100 different types of neuropathy, right? I've talked about that numerous times, but chemo-induced neuropathy and surgical-induced neuropathy and trauma-induced neuropathy. Those are the three big ones that we see. And here's the reason why: is a lot of times we didn't really do anything, and we're trying to treat something, and we end up with this ravaging side effect. So that's what I want to address, chemo-induced, because it's so prevalent. I have a lot of great information on stats, and it's very difficult to find more recent stats. So most of my stats are coming from around like 2016, 2017, and not 2018 to current. But they're still very telling to the situation with chemo-induced peripheral neuropathy. And then we'll also touch on radiation-induced peripheral neuropathy, because that's actually that's a different animal that shows up at a much later date. So let me hop in here and we'll get started on this one. So understand that when you're going through chemo, there's chemo-induced peripheral neuropathy can affect up to 90% of survivors who receive a neurotoxic type of chemotherapy. And there's lists of what those are, but honestly, the easiest thing is if you're facing a battle of cancer and you're choosing chemo as part of your treatment plan, you got to ask your doctors these top questions. One, is the chemo that I'm getting, is it likely to cause the peripheral neuropathy? Are you personally at high risk for peripheral neuropathy? If you have other autoimmune disorders in particular, you're at an increased risk for having it. If you've had chemo previously for other forms of cancer, you're at increased risk of getting it. So ask your doctor your risk of getting it. And then ask very specifically, what symptoms do you need to watch and do you need to report? And then also, have you treated peripheral neuropathy in other of their patients? How, and did it work? Usually with that answer, they're going to get the standard treatment, which is utilizing an EMG to determine it, and then utilizing the standard medications like gabapentin and Lyrica and other antidepressants like Cymbalta. Those are the common ones that they use, and that's pretty common when I see people with peripheral neuropathy from chemo. But ask them what other options they have, and then also ask them, if your peripheral neuropathy gets bad and is very painful, will it change your treatment plan? And will your peripheral neuropathy get better or go away after treatment is over? Get those top 6 questions answered, because then you'll know what you're dealing with and what you can anticipate. Now, when I sit in front of people, there are some people who have chemo-induced neuropathy and it was really bad in their hands and feet. And then one starts to go away, but the other one is still, the ravaging effects are still there. And so most people are told by their oncologist that chemo-induced neuropathy can go away, but it could take up to a year. So I decided I wanted to dive in and I wanted to find out when chemo usually shows up, and then how long does it usually stay after? So this came from an article on Science Direct, and it said usually the maximum, like the highest overall prevalence of the peripheral neuropathy shows up within the first month after treatment. So some people I've heard say that it shows up like within their first dose. But what this article didn't take into consideration, and they said this, was it didn't talk about the doses. So they said in the first month is what they saw on average. And when they looked at, gosh, I don't know, there was hundreds of studies. There was over 4,000 patients that they looked at. So the average was in the first month. But it can be dose dependent. So if you have an aggressive type of cancer that you're taking chemo for and you're getting very aggressive treatment, it may be sooner. It may, if your chemo is more spread out, it may show up later. So understand that it usually falls over time though. But approximately 1/3 of those patients can expect to have chronic peripheral neuropathy 6 months or more after the end of treatment. So it does have a negative impact on the long-term quality of life. So they're trying to find effective treatment. So it shows up, and you'll know usually within the first month to 3 months of treatment if you're going to have the peripheral neuropathy. So then I wanted to find out, okay, talking about 6 months, a year, I wanted to get past that point and see within some of the research out there. And this was a study, they were looking at females in particular, but then the end of the study, they said essentially it was the same for males versus females. But at an average of 6 years after your cancer diagnosis, 45% of patients still had symptoms of nerve damage, such as loss of feelings in their hands and feet. And then it was associated with increased risk of falls that the study also found. And so the risks were the same males versus females. So chemo-induced neuropathy is real. It happens. Most doctors, I have an oncologist that refers to us, and he was very upfront, and he's like, I'm just very thankful that the patient is alive, that we've had an opportunity to get them to where they need to be to sustain life. He's like, but I'm not going to pretend that there's not side effects to chemotherapy, and he doesn't have tools in his toolbox to handle it. And so that's why he refers to us. But Cancer Treatment Centers of America, they also they work with chemo-induced neuropathy, or try to, but I've had clients who go there and use similar treatments that we do, and yet they're still not getting results until we're looking at as a whole person. So understand that looking at you as a whole person is where you have to start, because your journey with neuropathy is unique. Now, when it comes to radiation-induced, there's less research on radiation-induced neuropathy. In the one article that I could find, it showed a prevalence that radiation-induced neuropathy symptoms of that pain, numbness, tingling show up 6 years, on average 4 to 6 years after the last radiation dose. So what's difficult is trying to find literally the correlation between having the radiation and, I mean, this is a person who has never had chemo, they just had radiation, and neuropathy. It's there, but they think so many other things could be going on, so they don't even correlate it to being the radiation induced at all. So understanding your prevalence of getting the chemo-induced peripheral neuropathy is, one, is the type of chemo you're utilizing, two, any other previous risk factors such as other health conditions or previous cancer and use of chemo. All of those increase your chances of getting it. Having a good conversation with your oncologist to understand their understanding of it, what they do for it, what you should say, and if it changes your treatment is very, very important. But I also want you to realize that the harmful effects can last for years, but they don't have to. So we have had numerous clients come in who truly want to have a better quality of life, that their family is celebrating that they're done with chemo and that they're in remission, yet their quality of life is still terrible and they can't celebrate. Quality of life is what's important. If we don't have our quality of life, what do we have? So we can celebrate that you're alive and hopefully cancer free for the rest of your life. But improving that quality of life is necessary. So I'm telling you that there is hope. Catch one of our other webinars, understanding there's a different way to look at peripheral neuropathy. Myself, being a neuropathy survivor, not from chemo, but have worked with many clients who have chemo-induced neuropathy. know that you don't have to suffer with the effects of the pain and the numbness and tingling. But it takes work, but you're worth it. So reach out if you have questions, and catch us on a webinar or look at any of our other Everything Neuropathy videos so you can gain more information and insight. Thank you so much.